Africans have been called on to act responsibly during this festive season break to help control the spread of the Omicron variant. The need for increased vigilance has again come under sharp focus, especially with the backdrop of the announcement that possible future variants could completely escape vaccines. That's after the Pfizer vaccine showed a lower efficacy rate against Omicron. That is based on a study conducted by the South African Medical Research Council and Discovery, the results of which were shared this week. Let's speak about all of this now with Dr. Nicholas Crisp, the Health Department's Deputy Director General. Doctor, always good to have you on Newzroom Afrika. Grateful for your time. So today is a public holiday. Many people will be going into a long weekend. How significant or important will be our behavior over these 4 days, especially when you look at the trends with Omicron?
Yeah, good evening, and good evening to the viewers. We know that this is an extremely transmissible variant, which means we pass it on from one another very quickly and easily. So with the holiday seasons coming and perhaps even have started, it means that people are going to be seeing one another in crowds and large groups of people, letting their guard down, taking their masks off, perhaps having a drink, and that's going to be a bit of a problem because it's much easier to spread the virus. So we're really asking people to protect yourself and to protect those around you. Please be extremely aware of wearing your mask properly, washing your hands, staying in ventilated places, and just generally trying to maintain social distance as much as is possible. And of course, if you're not vaccinated, get vaccinated, because we do know that vaccines protect us from severe infections.
And how critical, we're talking about critical human behavior. The reality is many of the people who are going home or going away will be seeing people they haven't seen for the better part of the year, and the most natural thing will be to drop our guards.
Yeah, well, we recognize that. I think we can just be grateful that it appears that Omicron is not being as vicious as the previous waves. We're seeing a sustained pattern of less very severe infection. But that does not mean we are not seeing severe infection. There are a number of people who are really in trouble in hospital, on ventilators, and fighting for their lives, even with this variant. So while we know and we recognize that people do want to get close to their families and are going to move around, the less that happens and the more we are able to contain ourselves to smaller groups and not to hang out in pubs and do other things unnecessarily, the more we'll protect ourselves. We are very vulnerable at this time.
At what rate would hospitalizations be alarming? Is there a general percentage we can refer to, or is it more of a hospital to hospital, province per province reading?
Yeah, so I think we need to all understand that healthcare workers are extremely tired. In the public and the private sector, they've had 2 years of non-stop work. They've seen the worst of it. They've had to find new ways to treat patients. They've had to struggle with friends and relatives and patients dying. And it's extremely mentally stressful for the healthcare workers. There are also healthcare workers who have been infected and are either at home with mild illness and maybe some with severe illness. So the staffing may not be at the optimal. So the whole system is quite vulnerable at the moment. And although a relatively few beds, especially the COVID beds and the ICU beds, relatively few compared with the capacity, are occupied at the moment, and that differs from province to province and place to place. You don't need to have large numbers of people to create a lot of work, and we would appeal to people to also drive slowly and to stay out of harm's way as best they can so that we do not stretch the capacity that we have in the health system.
So it's assessed per hospital, correct?
Sorry?
Do you assess in terms of a worrying level of hospitalizations? Is there a number that where you'd say if we reach that, now we know we're in trouble?
Well, so there are special set-aside COVID beds, including high care and ICU beds, as well as general ward beds. And at the moment, in most parts of the country, it's still under 20% of that capacity that's occupied. It will change from one hospital to the other in a flash, and that's the concern. So it depends also on staffing. We know we've heard reports from some parts of the country where although they have the beds, the bed itself is not useful if you don't have nursing staff and doctors to look after patients. So it will move from space to space and time to time. But right now, we are not in a critical position anywhere in the country. And there are staff for the beds that do have patients in them. But as I said, that can change very quickly if a large number of people are infected and if enough of them get very sick. Interesting, I was looking at the data of ICU patients in Chris Hani Baragwanath Hospital, and only one of the 13 patients that have been there for the last 2 days is vaccinated and is there for a separate reason. All the rest are unvaccinated patients. So I really want to appeal to people. There are vaccination stations open at the moment, and if you want to keep yourself out of hospital, even if you're going to get mildly ill, the way to do it is to get vaccinated.
And a lot of people will be traveling across the provinces, Doctor. I mean, Gauteng, for example, has the highest number of infections currently. There were, and I think there still are, those tests that are conducted and screenings, in fact, not tests, screening that happens when you enter a different province. Do you think we're doing enough of that?
Well, I'm not sure that it makes a huge difference anymore. We know that Omicron and COVID is widely spread across the country. The figures are very clear, showing us that other provinces are just marginally behind Gauteng in the timing of this. We also know from what we've been saying to other countries, by the time you detect a variant and a new infection or flame of infection as the wave comes in, we know that by the time you are able to do that, there's already pretty widespread infection. And with a variant that is as transmissible as this one, that infection is widely across the country to every corner already.
If I can ask you about vaccines then, you've confirmed as government that boosters will be available for the over 60s. In fact, by the end of this month, December, there's a 6-month waiting period from the last shot if you got, for example, the 2-dose Pfizer regimen. Do you think we should stick to that 6-month period? Why is it important to stick to that? Because currently in the UK, for example, they're doing a 3-month period and basically vaccinating everyone who wants a booster.
Yeah, so, one watches the papers and the scientific papers and what other countries are doing, and we get advice here in South Africa, and there are varied opinions about what that interval should be. There are some that are showing us that the interval, if it's a little bit longer, you get a better immune response than if it's too short. But it is also about what is cost effective. If you are constantly having to vaccinate every 3 months, we will definitely start putting strain on the system. And if we are getting enough sustained immunity for a longer period, 4, 5, and 6 months, then obviously that is better for the system and it's more manageable on the ground. So at the moment, the Health Products Regulatory Authority, SAHPRA, has approved a 6-month interval, and we are sticking to the approved interval of 6 months for the Pfizer vaccination. For those who are in the designated immunocompromised groups of people, we are already vaccinating them. There were somewhere in the order of 7,000 have already been vaccinated. That is not a booster dose. It's an additional primary dose that is given after 28 days to people whose immunity is compromised because they're on some form of treatment or they have a disease that is suppressing their ability to make an immune response. So I think that is really where we should be targeting. We need a larger number of people to get their primary vaccinations. We do need to make sure that we provide booster immunity or boost the immunity of people who are vulnerable, especially older people. And we have deliberately been trying to boost healthcare workers' immune status with additional vaccines being given over the past month and a half. So for now, that is the regimen that we have, and times may change that. But we are vaccinating every day, and I would really just encourage people, if you qualify, if you have never had a vaccination, go out and get vaccinated.
I wonder, Dr. Crisp, if in the last few hours government has been able to discuss or even formulate a position on this study coming out of the US. Yes, yet to be peer-reviewed. It's a lab test that looked at the J&J shot, which says without a booster, here's what it says, that it suggests a low to absent antibody neutralization against Omicron.
Sure. So we've been watching that for a long time because our Medical Research Council and the team that has been doing the Sisonke study and now the Sisonke 2 study has been watching that for some time. We also all know that immunity is not about antibodies alone. It's also about our cellular response. If it were true that we had no immunity at all from Johnson & Johnson vaccine, we would have every single healthcare worker sick because that's the vaccine that they were given. So we know there's something else going on, and clearly the cellular immunity is doing something. So we are expecting to hear, if not today, where's today, Thursday, by tomorrow or early next week, the approval to proceed with boosting of Johnson & Johnson with another Johnson & Johnson dose outside of Sisonke. The Sisonke 2 study for healthcare workers terminates tomorrow. So this is a moving target all the time, and there are a lot of people who are looking at each of these vaccines. There are also some recent advisories that are out in the World Health Organization space about what we call heterologous boosting, where there's different vaccines being used. I'm sure we're going to see some changes in the weeks and months ahead, but there's still a lot of people in this country who have not gone for their vaccination, and that is a big part of our problem.
And yes, the Sisonke trial study comes to an end. Majority or many healthcare workers in this country were vaccinated with J&J under that study rollout. Currently, there were concerns about a sluggish uptake in these additional shots among healthcare workers for J&J. And when we spoke here on the program to one of the representatives from Labour, they were saying some of the doctors and nurses are saying they are waiting because they want to see if they could perhaps boost with a second vaccine, say Pfizer, for example.
Well, we hear the same thing, and there are various lobby groups, and people have their various views about this. But I don't think it's particularly wise to wait and go and work in an environment where there's so many COVID-positive people and not get the protection from the Johnson & Johnson vaccine. This is not a competition. This is a time when we should all be protecting with what we have available. So right now we have regulated and approved the study for Sisonke 2. For me, it's disappointing that only about half of the healthcare workers who had been given their doses under the Sisonke 1 came for their Sisonke 2 doses. Who knows? Maybe they'll be given a different vaccine in 2 months' time or 3 months' time as the regimens change, but they will have been protected through December. And I think it's unfortunate
All right, Dr. Nicholas Chris,
people have made a sort of a competition of it.
Okay, Doctor, thank you so much for your time on News at Prime tonight. We lost you there for a bit, but we were able to catch the last bit of your comment. Thank you very much for that. That was the Department of Health's Deputy Director General, Dr. Nicholas Crisp, speaking to us about a number of issues as far as South Africa's battle with the COVID pandemic is concerned.